Hey, this is Dr. Murchie. Hope you're doing really well. I want to talk to you about something that's really exciting and very cool in dentistry. One of the things that nobody likes is impressions. You know, these things that you put in your mouth, there's a lot of goop, causes you to gag, takes about 3 minutes, it doesn't taste great, and then it leaves this mess all over your face. Here at Goochland Dentistry, we know you don't like impressions. You know what? We don't like them either. As a doctor and assistant, we don't like seeing you gag. Cleanup can be difficult. We don't like the time that it takes for the impression to set. And then the other thing that's really difficult is we can't evaluate things on your impression until our lab has done some of the work that they need to do. Another disadvantage of the impression materials is each impression costs anywhere from $20 to $25 a piece. So we made a conscious decision to improve your experience at our office by investing in a digital scanner. We invested in an ITero element, which is a type of scanner that uses a wand to take a digital image of your teeth. You simply open your mouth, and we scan your teeth. There's no goop, there's no gagging, and it takes about 3 to 5 minutes to get processed. So what's so cool about this besides being gag-free? One of the really neat things is there's improved quality control. As soon as we scan, I have an image that tells me where the tooth is, and I can evaluate, did we have all the information that we need? This little function right here will tell me if there's enough space between the crown, the tooth that we've shaped, and the tooth above it. And I can also check to make sure the bite's right. I can blow things up so they're very small, and I can look really at real fine detail, but I can also look from a distance. This enables me to better communicate with my lab. With the digital scanner, we're able to compare over time how your teeth wear and if there's changes in areas of recession. So for example, this is my mouth. This was a scan that we did in May of 2018, and about 2 months later, you can contrast that. 2 months usually isn't a lot of time, so I'm not seeing a big change. But if you're grinding your teeth or you have recession, we can track this over time. Some of the other things that's very nice is when you're doing Invisalign, we can track how your teeth are moving if things are tracking according to the way we planned. We call this process digitizing your smile. When we have your smile digitized, we have a record that is stored in the cloud that we can then use to restore your teeth back to where you were. On the odd chance that you have an accident or you break a tooth, we can say, hey, I really like to get my teeth back to where I started. Can you put my teeth back where they were so it looks like nothing's happened? That's a wonderful advantage. Another advantage is that you have the ability to do what we call a smile donation. If you have a relative that you like their teeth, you can scan their teeth. We can copy and paste their teeth, and when we make final crowns for you, make them match their teeth. So those are some of the beginning advantages of the digital information. There's a lot more we can do with treatment planning to make sure that when we communicate with our laboratory, when we communicate with technicians, we're able to communicate much easier because everything is stored on the cloud and we can talk to things, make sure things are working better for you. This is Dr. Murchie, Goochland Dentistry. We would love to see you. Thank you very much.